Good afternoon. Thanks for joining. We'll get started with the presentation. We want to be respectful of everybody's time. And also, if you could, I could put in the chat box to put your name, organization, and any tribal affiliation when you have a moment. So welcome to our electronic case reporting project, office hours, and technical assistance session. Next slide. So again, we want to thank you for taking the time to meet with us today to give us some space to talk about the project. My name is Tiffani Stark. I'm one of the public health program managers here at NCUIH. And also joining me today is my colleague, Myca Hunthrop, who's one of the public health project coordinators at NCUIH. And she'll be co-hosting the presentation today with me. Next slide. And so if we have any new folks, we'll give a little about NCUIH. So NCUIH is a national representative advocating for the 41 urban Indian organizations, or UIOs, contracting with the Indian Health Service under the Indian Healthcare Improvement Act. NCUIH strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas, supported by quality healthcare centers. So today we're going to take a look at what is eCR, also looking at the benefits of the program, taking a look at a couple of our UIO testimonies from past sub-awardees, and then also taking a look at the application, and then helping answer any questions that you may have. So to begin, electronic case reporting, in case there's folks that are not aware of it, so it is often referred to as eCR for short, is the automated real-time exchange of case report information between the electronic health records and public health agencies. So the key phrases as highlighted are automated in real time, which reduces the burden of manually reporting the patient communicable diseases, and eCR securely transfers the data for disease tracking, case management, and contact tracing. So on this slide, we have an eCR graphic that is pretty helpful to see the flow of eCR. So taking a look at it, the patient is diagnosed with a reportable condition, and then the healthcare provider enters the patient's info into the EHR. Then the data is automatically triggering a case report that is sent to the appropriate public health agency. And then the public health agency receives the case report in real time, and response is sent back to the provider. And state or local health department reaches out to the patient for any contact tracing, as example. And here we have another eCR graphic that kind of shows the behind the scenes process of the electronic case reporting. It could be helpful for folks to see the whole process of how it works. And now taking a look at the provider benefits. So it's really important to help eliminate that manual data entry and reporting. It will streamline the jurisdiction reporting challenges. You receive information back from the public health associated with the reportable condition. It will fulfill legal reporting requirements and can be implemented for all reportable conditions. And it also fulfills the CMS promoting interoperability program requirement. So now we'll take a look at one of the UIO's testimonies, who was a past sub-awardee from our year one. So Fresno American Indian Health Project. They're an urban Indian organization. They're FQHC. They provide medical, behavioral, psychiatric, case management and youth services. And their EHR is the next gen platform. So taking a look at their process, it did begin starting in July 2020, when they were requesting that initial ECR capability. And they had to continuously reach out to NextGen for those 2 years to begin ECR. They were a pilot site, so it was kind of a process with getting things built out, but also, trying to really work on that communication. So then in June 2022, Fresno applied to work with NCUIH on the ECR project, and their soft go live was July 2024. Next slide. So then taking a look at Bakersfield American Indian Health Project, they were another year one sub-awardee. So they're a limited ambulatory healthcare facility. They provide services such as behavioral health, youth prevention, nutrition, and their platform is Greenway, and that uses the fire. So they applied back in June 2022. They were originally scheduled to have a go live of December 22, but then that got pushed back multiple times for trying to work out things behind the scenes with the EHR. So their soft go live was also July of 2024. So taking a look at our next steps, so we are working with NIHB to partner together to increase the number of UIOs who are integrating eCR with their electronic health record for efficient community support. We really encourage UIOs to apply. We will be awarding up to 3 UIOs who will be selected subject to availability of funding. And we do have a QR code on the screen for folks if you want to pull that up and take a look at that. But we'll also take a look at the application real time right now. Thank you, Myca. So as you can see, we have a little bit more background on what is eCR and some links that are helpful as well. And then it will get into the provider benefits that we discussed, showing the flow of eCR, and then talking about the core requirements. So obviously this is for a commercial off-the-shelf system, not RPMS, and making sure that the appropriate approvals from UIO leadership and NCUIH and National Indian Health Board, CDC, and so on. Some of the other requirements would be attending monthly meetings with NCUIH and NIHB to help with technical assistance support, create and submit a work plan with a budget for how that 80,000 will be utilized, submitting a final report on the work plan, complete the activities checklist accordingly, which will mirror the core requirements that are listed out in the contract. So it's really there to help visualize and track what's being completed, and that will help support for the payments being submitted. And then work with CDC onboarding team to implement ECR, and work with NCUIH and NIHB to develop a tribal ECR roadmap for how ECR implementation went for the UIOs and to help UIOs in the future. And then looking at the funding, so 25% of that 80,000 will be provided to the UIO following the signing of the contract, and then the remaining 60,000 will be divided into 2 payments, which are broken out for deliverables that are completed. And that's also listed in the activities checklist that I mentioned before. And then throughout the process, we are here to provide any other additional technical assistance support with meetings, calls, whatever is needed to help with the project. And down below, we have the fields that would just be required to complete. It's not too lengthy of an application, so that's nice. And yeah, it's pretty short for the application. But yeah, we could pause there and see if there's any questions about ECR, the project, timeline, funding, anything like that. Okay. Ashley, do you have a question?
Yeah, so my question was, so on the form, it said like to look to see if your EHR is compatible, like on the CDC website. And we have NextGen, and that's not on there. However, you just said that it does work, and NextGen is saying that it does. So, am I correct that we're good to go with that?
Yeah, that's a good question. So that list that is on that CDC website, that list is showing the ECRs, or the EHRs, excuse me, who were pretty like swift with the process and like have everything built out. I don't want to speak for next gen, but I think they maybe weren't on that list because there were still some things that they had to finish behind the scenes. But yeah, it shouldn't deter you from applying. And also for us to move forward with the project, we've had a past sub-awardee, Fresno, who had next gen, and they're in their soft go live phase.
Okay, thank you very much.
Yeah.
Yeah, NextGen actually just sent us a PowerPoint thing, like the 25th, I think. So saying that it was also on there. So hopefully they've got some of those kinks worked out.
Yeah. And maybe too, like that list wasn't updated recently too for the
Yeah,
CDC list. But yeah, great question. Thank you.
thank you.
I'm just checking the chat. Adam, can you go back to the navigation chart? Yes.
Quick question. Sorry. How long is this funding supposed to last?
Yeah, great question. So the funding goes through July 31st, 2025. However, we did speak with NIHB and they said that we'd be able to apply for like a no cost extension since there's only a few months left. And we know that the work could definitely go past that time frame because of course anything technological, especially in this case, there might be some build outs and things that need to happen.
And then because our agency uses Greenway, they've been kind of a headache because they're just very bare bones in how much they provide. Would we be able to reach out to Bakersfield if we were awarded this to get assistance with how they got set up?
Yeah, I think that's definitely a good option to have that peer-to-peer support. I'm sure they would be happy to help answer any questions and give recommendations for the process for sure. And then also to the CDC ECR team is very good with making sure that the communication is happening with the UIOs EHR system. So they've been really good about that and making sure things are, happening and just staying on top of it all as well. Oh, yes, and thank you, Micah. Micah put the link in the chat for the peer-to-peer session with another UIO to request that through the TA form. And then we could definitely get that set up for you. double check to see if there's any other questions. Okay, perfect. And we'll also drop the link. Oh no, Mike, I already did that. Thank you. The link to the application is in the chat as well. So if you weren't able to pull out your phone for the QR code, the link's in the chat. And then we'll also give you the link to the event evaluation, so you can let us know how we did today and if there's any other information that would be helpful for this project or anything else relating. We would definitely appreciate that. But that concludes our presentation today. We'll hang on the call for a bit to help answer any other questions that may pop up or if there's any other UIOs who may join.